In a lengthy Facebook post, a doctor at Eisenhower Health describes what's happening now with coronavirus as a hell show. Dr. Rick Loftus also writes that doctors are deciding the ethical way to divide up the limited drug remdesivir for hospital patients. Today, I spoke with the chief medical officer at Eisenhower, Dr. Alan Williamson, about this post and the latest at the hospital. Dr. Williamson, great to see you again. Thanks for joining us.
Thank you again, Peter.
Let me begin by asking you, sir, how are things right now at Eisenhower?
Well, we continue to see a steady rise in the number of cases here at the hospital. We're over 75 cases in the hospital today. So just a progressive increase in the volumes. We're still able to keep up with that, but it is continuing to put quite a strain on the healthcare system to be able to meet those demands, to be able to staff the units on a regular basis. This has been going on for over 4 months now, and the staff is getting tired. It's hard work. They're having to don the protective equipment and then take that off each and every time they're going in and out of the room with these patients. So just physically demanding work as well as mentally taxing. And we prepare in healthcare for emergencies that typically last for maybe days or perhaps weeks at the most, but something that's going to go on for months and months and months is very taxing for us.
I want to ask you, sir, about this post from Dr. Rick Loftus at Eisenhower that's generating a lot of attention right now on social media. He writes that the hospital right now is a hell show, and that yesterday they spent time deciding the ethical way to divide up limited remdesivir, 30 patients worth for the hospital patients. Is that what you're seeing, that they're dividing up and trying to figure out ethical ways to give that medicine?
Yeah, at this point, we are really not to a point where we're having to make that kind of decision. What we are doing is looking at who would be most likely to benefit from the use of remdesivir. There is a national shortage of remdesivir as it's being used up rapidly across the country to treat these patients. So we are really analyzing which patients do we believe would best benefit from that, so that when we get to a point where we really are running out of this medication, then we can allocate it in a way that makes sense. Rather than just random allocation, we would hope that we could identify some patients that are very likely to do extremely well no matter what we do and don't really need to be treated with remdesivir. There may be some patients that we feel the likelihood they're going to benefit and recover if we use that medication is so small that it might not be an appropriate use of the medication. So that's where we are at this point, is really trying to analyze where does it make the most sense to use any precious resource we have. That's not unusual for us to have to make those kind of analyses.
And does the hospital really feel like a hell show right now?
I'm not even sure what that phrase would mean. No, we are just doing our job and caring for the patients in the community. It is hard work. It is exhausting work for everyone. We do appreciate the support that we get from the community who recognize the work that we are doing.
Let me ask you, Dr. Williamson, what is the mood like right now at Eisenhower? Is it difficult for a lot of the doctors and nurses?
So it's wearing on people again because of the duration of this crisis. But it is also very heartening when I go out on rounds and go into the COVID units and see the nurses. They continue to have a great attitude. They come to work in the morning. They are raring to go. They're proud of what they're doing. They know they are helping their community. They're doing what they became nurses to do, and the rest of the support staff as well, not to leave out the respiratory therapists and nurses' aides and all the other people that are required to care for these patients. When they go home at the end of the day, I see them dragging out pretty tired. And we are concerned about the duration of this event, and are we going to start seeing people really just getting worn out and broken down and potentially getting sick because they're run down. So we continue to do everything we possibly can to rotate staff around, to give them breaks, to be sure that we adjust staffing ratios so that it's appropriate for the intensity that's required to care for these patients. But this is a long haul event for us.
How's the surge capacity?
We are holding our own on our capacity to be able to care for the patients. We have been able to expand our capacity progressively as we see more patients coming in. So again, we're doing okay right now with that. But we are beginning to sort of bump up the capacity limits here and having to look at how are we going to be able to not only provide rooms for the patient, but the most important thing is how are we going to provide staff?
And are you still seeing younger patients with coronavirus?
Yeah, we are definitely seeing a younger average age. If you want to just look at the average, it's not that all of a sudden we're only seeing 20-year-olds. We still see 70, 80-year-olds, but we are seeing some of those 20, 30, 40-year-olds, lots of 50-year-olds. Seeing a more broad-based demographic across the board rather than our early experience, which was primarily just the elderly patients.
And are you still also seeing patients coming in from nearby Imperial County?
We've seen very few patients recently from Imperial County. Most of what we're seeing is definitely from our own Coachella Valley catchment area.
Okay. County health officials today say that the positivity rate is around 15.9%, which is almost double the state's threshold of 8%. Your thoughts?
Well, positivity rate is an interesting thing. There are so many factors that weigh into that, how many patients you're testing. There are continuing to be fluxes from day to day and week to week on who we can test, how much testing equipment and supplies we have. So that impacts it. But I don't think there's any question in anyone's mind that there is an upsurge in the number of patients as well. So a little hard to really reconcile exactly how much of that is some challenges on the testing side and how much of it is true increase positivity rate, if you will, across the community. I think it's a mix of both. Our predictions show that this probably extends through into the mid part of August, and then hopefully we finally see a peak and begin to get beyond this. But that means we still have about 6 more weeks that we really need the public to pull out all the stops, do everything we can to try to kill this.
All right. Dr. Williamson, we appreciate your time. Thanks for joining us.
Peter, thank you.
Dr. Loftus declined our request for an interview, but says what he wrote speaks for itself. You can read his full Facebook post on our website, kesq.com.